Yes, sir.
Is there any difference between the Massachusetts Medical Care Program and Obamacare?
What are the differences between the Massachusetts Medical Program and the President's Health Care Program? The President's Health Care Program owes its heart and soul to how the Massachusetts program has evolved. Its heart and soul is based upon that. In fairness to Governor Romney, he points out that it's evolved differently than he originally planned. That's a fair statement. But the fact is that the President's plan depends upon that Massachusetts plan as a model. And they're having all the problems that we can imagine we're going to have as a country.
Well, they're very similar.
Very similar. Very similar. Anyone else?
So why is he going to campaign against Obamacare when he,
The question is, how will Governor Romney campaign against the President's health care plan when it was based upon the plan he put into place? I can't speak for Romney, but I do think he'll be the Republican nominee. One, his point is, that's a fair point. He says states were always designed to be places of experimentation. What has happened in Louisiana may be different than Utah, may be different than Massachusetts. That's okay. Our founding fathers said, states, you can come up with your own solution. But to take a program which is really drowning in cost, Massachusetts has the first or second highest premiums for small businesses in the nation. Medicaid is bankrupting their state. So here we can see a state whose program has not lowered cost, and yet now we're going to take it to the rest of the country. Romney has said that he will repeal Obamacare as an act of president, that he's president. And he said that although he defends his right to do so as a governor in Massachusetts, he doesn't think the president had the right to take what was happening on the state level and take it nationwide. I can accept that. I don't mind a guy trying as long as they don't try and voice their bad solutions on the rest of us. But at least he's trying. Anyone else? Yes, ma'am.
Any predictions on the Supreme Court's rulings on the overturning on the constitutionality of Obamacare?
Any predictions on the Supreme Court overruling the constitutionality? First, I was privileged to be in the Supreme Court on the Tuesday they argued the individual mandate. And I will say, as an American, I was proud. First, it was just, we understand that the president, who I think has tended to usurp constitutional power, is actually trying to defend what he's doing before 9 judges. Now, I'm not an attorney, obviously, but I was still impressed that, wow, in our country, we're not Syria, where if you disagree with somebody, you haul them out back and shoot them, or Venezuela, where they have a president for life. We're someplace where the most powerful man in the world still has to defend his decisions before 9 judges. It's something. As an American, as Americans, we should be proud. I think it came down, I can't predict, but I will say, when Justice Kennedy said, wait a second, this mandate expands the power of the federal government over Americans in an unprecedented fashion, extending the reach into their most personal life, compelling them to do something which the federal government has never compelled to do before. There must be a high degree of justification, number one. And number two, he then asked the Solicitor General, defending the plan, where does it stop? If Congress can do this, what can they not do? The Solicitor General had no answer for that. He couldn't say where it would stop. That was number one. Number two, the attorney working to say it was unconstitutional at the end said, Congress can come up with a statistical association with anything that Congress would then say was for the greater good. Oh, this is for the greater good, statistical correlation. Once this precedent is established, nothing will stop Congress from saying, indeed, statistical correlation, greater good, we shall now compel you. No one refuted that. Now, I'm a freedom guy. As much as I'm a doctor caring for the uninsured, we are great because we are free. And working in a hospital for the uninsured, I know that when the patient has the power and the freedom to choose care, the patient's freedom is preserved and the care they receive is better. I was encouraged by this line of questioning. When the patient has the power, we're well off. When the politician has the power, watch out. And that was really good. But I don't know. I just, maybe one more question? Yes, sir.
Coastal erosion, we've been talking about it for years. We've seen no major work done on the coastline. And there was a very nice article in the Congressman this morning that says the best we had 20 years.
Yeah.
They'll do something now. Your thoughts?
You know, long before I knew I may have the opportunity to represent this area, Clifford Smith came with the Army Corps of Engineers to D.C. to meet with us, and we ended up speaking entirely about coastal restoration. I probably had 4 or 5 conversations with Clifford or with Wendell Curall since, as well as others on coastal restoration. There's much wisdom in this community on that issue. And speaking to folks, they truly think that the plan the governor's put out is a credible plan. Before, and Reggie Dupree thinks this, I think I know that Reggie was the one that either proposed or seconded the approval of the plan. Now, Reggie Dupree sat next to me in the state senate, as he said he was coastal before coastal was cool, and I've attempted to learn from Reggie. And so when Reggie either seconds or says, let's approve the plan, that's important to him. And the thing that is also important is that there are specifics. We are going to do this project for this reason, and this project for that, and this project for yet another reason. And then they say the money will come from here, and the money will come from there, and the money will come from here. I am told there's never been that level of detail in a master plan before. Now, clearly this area had lots of concerns. So when they came down to Homa and they had their community groups, there was a lot of input. I spoke with Garrett and his lieutenants right afterwards. I said, listen, the people in Lafourche and Terrebonne are concerned about this. They said, we've heard them, we've changed the plans, we've moved something from a little bit further north to a little bit further south. We think we'll still get the same bang for the buck. So I would like to think that we've come to the point of decision regarding coastal restoration. One of my favorite quotes, Samuel Johnson said, there's nothing like a hanging to sharpen a man's mind. We in Louisiana, after Hurricane Katrina's and Rita's, etc., know that if we don't restore our coastline, we're toast. And so, I would like to think that master plan with funding sources attached to it will be the beginning of a way to fix it. Y'all have been very generous with your attention. Again, I look forward to working with you. My personal email is williamcassidy@gmail.com. If somebody has some way, that comes to my BlackBerry, the one I carry in my pocket. So if somebody has something they want to contact me about, please do so. We have a mutual responsibility in our democracy. I'm to represent, but you're supposed to tell me what to represent. I look forward to hearing from you on those issues. Thank you again.